Good afternoon, ladies and gentlemen. This is Robert Chappell, Executive Editor at Madison365 with your daily update for Monday, September 14th. Support for Madison365 and your daily update comes from Milwaukee Film, presenting the Minority Health Film Festival, now until September 24th. I think there's like 50 movies that you can get, basically streaming. This would normally be an in-person cinematic experience in the city of Milwaukee, but the way things are now, it is all online and it's all virtual and it's all like Netflix style streaming. So you can pay one price and get all the movies through the Milwaukee Film app, and then also attend all the talkbacks and events and panel discussions and things virtually online. So check that when you can. It's at mkefilm.org/MHFF. So we have not a lot of new news today on the numbers. So we'll get to that pretty quick, and then we'll talk a little bit about the University of Wisconsin and where we're going there. We did have a media briefing with the Chancellor today. She said some interesting things, including that she doesn't regret opening the campus, despite the numbers being what they are. So we'll get to that in a minute. Let's get to the numbers first. Yesterday, you'll remember, is a record-setting day. Over 1,560 cases yesterday. Positive test rate of 20.45. That positive test rate really is supposed to be under 3. Really should be under 10 to be considered, before we can consider ourselves to have this at least a little bit under control. So that was yesterday. Today, much fewer tests. Only about 4,000 tests, actually a little bit under 4,000 tests today, which is not atypical of a Monday, right? Because we're looking at tests that have been conducted and processed in the past few days, and weekends typically are a little bit slow on those. There's more testing happening on, with UW campuses and things right now, but a lot of that was already reported yesterday. So today, it's not shocking that we have a lower number of tests. However, we're still at about 20% of those tests came back positive. Again, it's a smaller number of tests, therefore a smaller number of positive cases, 771 today. But that's why you pay attention to that percentage, because obviously you do more tests, you get more positive cases. You get fewer tests, you get fewer positive cases. That's why you don't necessarily look only at the positive cases. You look at the positive test result, or at the positive test rate, rather, which is 19.7% just for today. But again, you also don't want to look at that for any particular day, because it's possible that a particular day, a particular location was targeting a particular population. For example, if we know there's an outbreak at a particular workplace, and a county only tests people who work at that workplace, then they're more likely to be infected, and the percentage is going to be higher. That doesn't necessarily give you a good picture of the entire community, right? It's also possible that many counties don't immediately report the number of negative tests. So what you end up with is, they test 100 people, 12 come back positive, and they only report the positive results because those are the priority. So it looks like they only did 12 tests and they got 12 positives, another 100%. So again, some of that one day jump in positive test rate can be a little bit misleading. So that's why you want to look at positive test rate over time. And our positive test rate over time is still not very good. It's still 15.75% over the past 7 days. And it's 13.5% over the past 14 days. So neither of those numbers is very good. Our average of new cases also, even though that's not the number we want to focus on, it is a good number to look at. Our 7-day average is 1,171, and our 14-day average is 1,029. Our total number of cases, remember I said yesterday we were probably going to pass 90,000 today? Didn't quite make it. 89,956. 10,200 of those are considered active. So that's about the same as yesterday, that's as high as it's ever been. The highest I saw before yesterday was 9,900. No new fatalities today, which again is typical of a Monday. We had one yesterday, but I had 12 the day before that. Those typically come in over the course of the week, sort of more midweek, just because I'm not sure exactly what it is, but they're getting those from a different source. They're getting those from medical examiners and coroners. So it takes a couple extra days to get those reported. I know of at least one fatality in Dade County that took like a week to make it into the data. So it's good that we have no fatalities to report today. That doesn't mean we haven't had any loss of life in the past 24 hours. We have averaged 6 deaths per day over the past week, 6.15 over the past 2 weeks per day. And again, that's that number. As bad as that is, to lose 6 people a day, you wouldn't lose 6 people every day to the flu, So that still feels like a lot to me, but it's not as high as I worried that it could be. And and it could get much higher than that with these numbers that we're seeing this past week, these past 2 weeks. I would anticipate that daily death number going up when we get to October, just because it's like a 4-week lag. When you see an increase in cases, you see an increase in hospitalizations about 2 weeks later, and you see an increase in deaths about 4 weeks later. And we do see an increase in hospitalizations today. Kind of a big one. Again, but that's not, we don't track hospitalizations to, in Wisconsin at least, we're not in danger of overwhelming the hospital system. We still have plenty of capacity everywhere in the state. We're not at that point where we need to build the field hospitals or anything like that, even though that was discussed at one point just to be prepared, but we ended up not needing it. But today we have 341 people hospitalized, and that's 28 more than yesterday. So that's like a 6 or 7% increase. 52% more than a week ago. 98 of those are in intensive care, which is 5 more than Sunday. Not a huge spike. Again, we're not at the point of, critical mass in the hospitals themselves. But we don't. But we do want to keep track of it because it just tells us what how severe the illness is. I mentioned a couple of localities. Kewaunee County, I don't remember being on this list before. Maybe they were one other time, but they have 14 new cases today. And this is one of those places where they're reporting 100% positive tests. Actually, they're reporting 107% positive tests, which is not possible, which makes me think that they did more tests than 14 and just haven't reported the negative results yet. So that will even out, the percentage will even out in the next few days. Which means that our actual percentage of positive results today is a tiny bit lower than what we're reporting. We're reporting 19.7 because that's the data we have. But the real number's probably slightly lower than that just because Kewaunee County, but Kewaunee County is not going to be doing enough tests to really meaningfully impact it. Right? So that once we get all those negative results in from Kewaunee County, it'll go down to like 20.5%, something like that, we are seeing continued cases in UW cities and Dane County, obviously 223 224 new cases today. Eau Claire County, 27 new cases. Kenosha County, 14. Well, Kenosha County is much better shape than it has been. Portage County, where UW Stevens Point is, 29 new cases. La Crosse County, UW La Crosse, 45 new cases. UW La Crosse is now, all residence halls are on lockdown right now. Walworth County, where Whitewater is, 23 new cases there. Oh, Grant County, where UW Platteville is, not on my list today, so that's good. That's good news for Platteville and that surrounding areas there. Mention rate of transmission real quick, and then we'll take some questions, and we'll talk about UW. Rate of transmission is up today, 1.23. We are second in the nation for rate of transmission. West Virginia is down to 1.27. They were up at like 1.4 the other day. Today, 1.23 for Wisconsin, second highest in the nation. Tied, actually, looks like we're tied with Delaware for the second highest. Again, what that means is every round of infections will be 23% larger than the previous round. So you have 100 people on average. We'll pass this thing on to 123 more people. So now you have 223 sick people. Right? That makes sense? And it will continue to spread faster than we're able to contain it. When that number is below 1, that means it's starting to go away. And that's where we were for like all of June. So to be back way over 1 the way we are is, I find, tremendously frustrating. That we worked really hard, or we were supposed to have been working really hard to get this thing under control, and we did for a while, and now we've given it all back, you know? Sorry if I seem to have hung up there for a minute. So Rachel asks, I'll take questions now if you want to drop any questions in the comments here, then we'll talk about University of Wisconsin real quick. Rachel asks, is there data average age of deaths over the past 2 weeks and months? Same for hospitalizations. We could probably figure that out. It would take some time. We know like the ages of deaths overall. Obviously tend to be older. But in order to get that for a specific time period, we would have had to have been tracking it every day. That's the only way that we have a lot of our data that we do, is that we track it every day. And that's not something we've tracked every day. We could probably ask for it from health services. The fact is that it is going that I don't think the average age of death will have changed over the past 2 weeks as opposed to the entire 6 months. Like, it's just more likely for a person in their 70s or 80s to die from this than it is someone in their 20s. Which is partly why we're not seeing as many deaths right now from this current outbreak. Or that we probably won't. You know what I mean? Like, if we were still at 2% of all known infections dying, we'd be seeing 20 and 30 deaths every day. But because, for several reasons, but one of them is that most of the infection right now is spreading among people in their 20s. And the UW Chancellor confirmed this, that most of those cases at UW are mild or even asymptomatic. We're not going to see that level of daily deaths because those 20 people in their 20s are just much less likely to die. Doesn't mean they're immune. I mean, just earlier this week, one of the deaths was a 20-year-old person. And we have had, significant numbers of people in their 30s and 40s who die. So I would expect to see that case fatality rate start to go, continue to go down. It has been going down to where it'll end up, in the 0.5 or 6 or 7 range total, because a lot of these new cases are in their 20s and will not get severely ill and will not die. They'll continue to spread it to people who are more vulnerable, for sure. But the 20-year-olds aren't going to be as vulnerable. Thanks for the question, Rachel. I understand that. Yeah, the simple answer is no. They just have the total number, and I bet if we asked them real nicely, they could break it out by month. But again, I think the average age is not going to change. The number of people who died in each age group might change week to week, but the average age of people who die is probably going to be pretty consistent. Okay, so let's talk about University of Wisconsin, which is really of interest to those of you who are in Dane County, because the University of Wisconsin is definitely having a big impact on numbers in Dane County, but not having a real super big impact on the state. Because even if we take Dane County out of the state data, it doesn't change very much. That said, the number of cases here in Dane County is definitely impacting the numbers here. It's like PHMDC, Public Health Madison Dane County, this morning. I emailed them to ask, and they emailed me back that the University of Wisconsin data is delayed by like a couple of days. So it's hard to say, like, of today's cases, how many are UW? It's just hard to, we don't know that. We do know that for yesterday's cases, 82% were between the ages of 18 and 22. Now the state, the county and the state do their age groups by like 10 to 19 and 20 to 29. So you have this big explosion among 10 to 19. They're probably not 11 and 12-year-olds, right? They're probably 18 and 19 because they're UW students. So they were good enough to be able to at least parse out 18 to 22 was 82% of new cases yesterday. We can infer that most of those are UW students. The university has been under some scrutiny, under some pressure, under some criticism for going to online or to in-person classes. A lot of classes are not in person. A lot of like graduate level seminars and even smaller, like upper level lectures have been online. And but a lot of other classes have been in person and have been conducted in a socially distant manner with masks on and everything. So Rebecca Blank, the chancellor, and some other administrators had a media briefing this afternoon, and I'll be writing up something from that when I'm done here. But the gist of it was that they wouldn't do anything different, that they think they'd made the right call, that they haven't seen any transmission happen in class. Like being in class, being in in-person classes has not caused any spread. And she said, and I find this compelling, that basically these kids were going to come to Madison whether or not they had in-person classes. They already had leases. They already had their housing squared away. They were going to come to Madison and do online classes. Let's hypothetically say the University of Wisconsin decided not to do in-person classes. What she's saying is that 35,000 students still would have come to Madison and just done their online classes from their campus apartments and dorm rooms. And would have been going socializing and spreading the sickness and everywhere, and would not have had a real strong connection to campus to be able to get testing and care and guidelines and that kind of thing. And she also said most students are actually following guidelines and not spreading it around. And she kept saying, people want the college experience, and that they really, she kept saying that she heard from people who wanted to come to class. Didn't really provide any evidence for that, and it was all anecdotal. Like there was no actual survey or anything like that. But she did say that students were offered the option, if you wanted to, that every major was instructed to have plenty of online classes, so that if you decided you wanted to stay home and do online classes, you could. I am a student in the graduate program. I do not recall receiving any emails to that effect. It's entirely possible that I missed one. I'm also not a freshman, so maybe a freshman got a different email than I did. I don't know. But anyway, I don't know whether this was the college experience that any of these kids wanted when they said they wanted the college experience. This certainly wasn't it. But I think her point is not a bad one, that you still would have had 35,000 new young people in town, downtown, kind of all cramped together, doing the college thing, going to parties and whatnot. And this would have happened regardless. That what's happening here is not because of in-person classes, it's just because of the existence of a university. It is, I think what else she said. You could also say that like they could have just closed the dorms. Like anybody who was going to go to live in a dorm could have, they could have just said, no, you can't come. Here's your money back and stay home. Other thing I will say, there's this assumption that they're just trying to run out the clock until September 28th, when after September 28th, they don't have to give refunds anymore, which is true. However, the chancellor said they're actually going to move that date, and they do want people to be able to get a refund if they decide to withdraw. So that's good to hear. She did not say whether or not football is going to happen. She did say if football happens, it'll be the entire conference. It's not going to be school by school. That if the Badgers play football, it means the entire conference is playing football. And if they're not, it means the entire conference is not. She also said 300 students are under investigation for violating health codes and regulations and instructions and whatever. And that 8 students have been suspended. Emergency suspensions for 8 students for, they didn't get real specific. I asked for specifics and they wouldn't give any, but just basically like having parties and things like that. So you have 300 students under investigation. You have 8 students suspended. There's some confusion about this because the chancellor said that they were looking into suspending 8 students. But then later they clarified that 8 students have actually been suspended. And that's pretty much it. They really doubled down on it, that they really feel like they didn't do anything wrong by opening the campus, and that if they had to make the call again, they would do it again the same way, knowing what they knew when they made the decision, which was actually, don't forget, back in July. Like, it's easy to say now, like, of course this happened, but back in July it might have not have been quite as predictable, but it was pretty predictable, honestly. Let's be honest. Okay, so that is pretty much all I have for you today. Let me see if there's any other questions. JJ asks, do the young affected heal quicker? I don't think so. I mean, anytime you have a disease or an illness that's more mild, chances are you're going to bounce back faster. I don't know what that means in terms of how long you're contagious. The number of active cases is what you're referring to, I think, JJ. Is basically anybody who's been diagnosed in the past 30 days and has not been documented symptom-free. So if an individual does get discharged from the hospital, for example, with no symptoms, they would actually be counted as recovered, even if it's within 30 days. I think most people don't go through that process just because most of these young people especially are just at home and they're not really being monitored, so they're in that sort of 30-day thing. It's also true that a lot of people have symptoms past 30 days. So 30 days is really just kind of a guess. It's not a guess, it's a good estimate in terms of active cases. So I hope that answers it. I don't know that they become no longer contagious any faster than anybody else, even if their symptoms resolve more quickly. I think Corey asked what the college experience is. I mean, especially when you come to a big school, if you're a small town kid like me, coming to a big school is kind of a thing. Like, the college experience is not just the academic experience. Obviously, is can be kind of cool, but just the social experience, and that's unfortunately the most dangerous thing in the world right now, is having that social experience. One other thing I'll mention that I just remembered from what Rebecca Blank said, that there are other institutions similar to ours, similar to UW, that did not have this level of spike. I mean, Michigan seems to have being in the same situations we are, but like Illinois isn't as bad. But one hypothesis that Dr. Blank posited was that Wisconsin as a whole is in rough shape. And a lot of these kids were infected when they arrived. So, like, you go to the University of Illinois, you're less likely to have brought the infection from home. Whereas Wisconsin, the entire state is, it's spreading kind of out of control into the entire state. And so it's much more likely that a small, and it wouldn't take very many, like a handful of students bring it from Green Bay or Calumet County or wherever they come from. And then those couple of students can really infect a lot of people in Madison. So that's one hypothesis, but she said really it's not clear why Wisconsin is in rougher shape than anywhere else. So, okay, that's pretty much all I have for you today. There's a few other stories up this morning. Mount Zion Baptist Church here in Madison just burned their mortgage and they're going to build a new community center on the south side, which is very exciting. There's a domestic violence prevention event on Friday for middle school girls, trying to kind of get them to recognize what healthy relationships are. That's run by Black Girls United and Ruby Clay. We have a story about that up on the website this morning. Take a look at those and check the podcast out. It's only 10 minutes, wherever you get your podcasts. And a great new episode of Black Oxygen today. We had the leaders of Black Lens, which is the Milwaukee Films sort of a program focused on Black films. And they're the ones running the Minority Health Film Festival right now. So there's a great conversation there. And the Black Oxygen podcast, so look for that. Appreciate your attention. Have a wonderful afternoon. And we will talk to you tomorrow.